Alrighty, hi there again. My name is Dr. Brian Evans. I'm the CEO of Sierra Nevada Memorial Hospital. I want to give another few updates. I've been doing some video updates on how the hospital is handling the COVID-19 pandemic. I want to make sure we talk a little bit about some of the comments I received on the last video, and just make sure that everybody's got the latest stuff. So I want to start with one thing. You know, there seems to be some confusion about the hospital's role in a public health situation like this versus the Department of Public Health at the county level and the state level. So, you know, some people seem unclear about where is the direction coming from in terms of testing and how things are unfolding from a governmental level. So we at the hospital are here to take care of acute patients who come into the emergency department, are admitted to the hospital. That is our essential purpose, but we work very, very closely with the Department of Public Health at the county. And that's where we're really getting a lot of our guidance from in terms of who should we test out in the community, how should we handle this as a public health emergency situation. So our county public health is, they're doing a great job. They're led by Dr. Ken Cutler, he's the public health officer, and Jill Blake, and we really appreciate their partnership. And they're getting a lot of guidance from the CDC. But that's where we're getting things like, you know, how many patients are we going to test, where are we going to test them, how does that work, and that's really crucial. On testing issues, I do think that there's been some changes that have been somewhat confusing as well. So initially in the COVID-19 situation, the idea was to test as many people as we possibly could, and it is helpful to test people in general to figure out how we're doing with this epidemic, or pandemic rather. But right now, because the turnaround times are not very good for outpatient testing, and we really want to limit the spread of this infection, if folks are not very ill in their home, that's where they really ought to stay. They shouldn't be jumping in their car and driving someplace to go get a test if they're doing okay at home. Obviously, if they're getting short of breath, or they're needing to come into the ER or the hospital, then that's what they should do. But that's kind of where we are on testing. That will probably change in the near future. The hospital will very likely have its own testing solution here in the near term, which will be very helpful for admitted patients and emergency patients. We don't have that up and running yet, and we'll certainly update everybody when we do have it up and running. I want to focus on OB a little bit because there's been a lot in the media, and there's been concern about OB departments all over the country and really all over the world. Because we have to worry about coronavirus in every part of the hospital and really every part of the community. I can say that we are doing an awful lot in the OB area to make sure that everybody is safe in those rooms and in that department. The cleaning that we're doing is absolutely the evidence-based COVID-19 cleaning, and it's extremely strict. We're working with our environmental service folks to really clean very, very thoroughly. We are limiting visitors in the OB unit, which I know can cause some stress for people, but we are certainly allowing a birth partner to come in with laboring moms during that very important event. And so we want to make sure people know that we're doing everything we can to keep folks safe. And we have a fantastic team of nurses and doctors in the OB unit. So that, I think, should be very reassuring for folks. Want to say thank you to everybody for their continued support of the hospital. So many people have volunteered to donate food, donate items, sewing cloth masks for our employees and doctors. It's so appreciated. As you may know, we've had one company who's donating face shields to us, and also donating hand sanitizer as well. It's really been kind of overwhelming and inspirational to see that level of support from the community. Please keep doing what you're doing as far as the sheltering in place. Make sure that you're doing the social distancing. That is saving lives. That is absolutely helping. Please keep doing that, and we will get through this whole thing together. Thank you very much, and I'll continue doing these updates.